So you may have recently seen articles like this saying that the choice of arm that you get your COVID booster in may make a significant difference, implying that your choice of arm matters. With this being the paper that we're going to review, that is what all of these articles are referencing. So first, let's break down some terminology because they're talking about choosing the ipsilateral or contralateral side for the second dose. So ipsilateral is a fancy word that means same side, contralateral, contra against, so opposite side. So it's really important just starting off that we're looking at same side versus opposite side of getting the vaccine that you previously got the arm in, not saying that the left arm or the right arm is better or preferred. So in this study, there was 147 patients that had the same side arm injection in a series of COVID vaccination, and 156 patients had opposite side arm, so having one arm with the vaccine and then the other arm with the second dose. Following this primary and secondary series vaccination, about 2 weeks later after that second dose, they did a blood draw, and they tested the antibody response from taking this 2-series vaccination to see if there was a difference between getting same side or opposite side vaccination, where the major finding is that both same side and opposite side vaccination induced a strong immune response, but secondary boosting is more pronounced when choosing a vaccine administration route that allows for drainage by the same lymph nodes used for priming, which is just a complicated way of saying that if you get the vaccine in the same arm for that second dose as you did for the first dose, you're going to have a better protective response than if you get it in opposite arms. So for a little background, originally a dual-dose vaccine regimen was authorized for COVID with the primary secondary series vaccine, and as always, these are administered in the deltoid muscle of the upper arm. And historically, we haven't really paid attention to the choice of arm used for series vaccinations, where most individuals choose their non-dominant arm for sequential vaccination, or it's defaulting to the person administering the vaccine based on what they're more comfortable doing. This study used Comirnaty, which is the Pfizer vaccine. Patients were recruited between the 1st of March and the 10th of September in 2021 out of Saarland University Medical Center in Hamburg, Germany, or the Robert Bosch GmbH, Hamburg, Germany Institute. Individuals either received both vaccine doses in the same arm or the second dose in the opposite arm, the contralateral arm. And then approximately 2 weeks later, blood was drawn from the patient, and they analyzed it for all of these things to see the immune response in a quantitative level, where patients were relatively young, about 40 years of age, with no known history of COVID infection who underwent this vaccination. The 2 doses were given about 6 weeks apart, as per German regulations, where the statistically significant findings are that the spike-specific CD8 T cell levels were significantly lower in the opposite arm groups than in the same arm groups. Whereas a reminder, the CD8 T cells are the memory cells. They're the ones where if you've had an interaction with the virus again, they're like, I remember you, and then they reintroduce this immune-mediated response. So all of this is just to say that if you usually get the vaccine in one arm, continue getting the vaccine in the same arm that you usually get it in.